Welcome back. In this video, I'll teach you everything that you need to know about lactose intolerance. Some people lack the enzyme lactase, which is important in digesting lactose. So these people become lactose intolerant. When they eat lactose or lactose-containing products, the sugary molecule remains entrapped in the intestine and not absorbed. So, the bacteria in the gut will feast on this sugar and release a variety of chemicals and gases. This of course causes bloating, diarrhea, and abdominal pain. And here's what's important for your exam. You will likely be asked about one of the following. Lactose intolerance causes positive hydrogen breath test, positive stool reducing agent, acidic stool, with increased stool osmotic gap, and there will be no steatorrhea, which means that there will be no fat in the stool. These features are highly characteristic and diagnostic for lactose intolerance. Food that almost always contains lactose is milk, cheese, ice cream, yogurt, and butter. Food that sometimes contain lactose include biscuits, cookies, chocolate, bread, cakes, and others. Choosing this diet and avoiding dairy products obviously puts the patient at a disadvantage when it comes to calcium and vitamins, like vitamin A and vitamin D. So they should supplement their food with more calcium-fortified food, such as almond, soy, oat milk, fish, and leafy plants. And here's a small quiz. Alright guys, that's all I have. Thank you so much for watching and hopefully this helps.